So in general, with the time we have, I'm just give you just a general answer. One of the studies, I was in a team that published last year. We looked at this question for soft tissue indications for PRP. And to summarize briefly, what we found was that 9 out of 9 studies that had platelet doses below 3.5 billion platelets showed zero benefit versus placebo or control for soft tissue applications. And that included tendinopathies, that included ligament applications, included muscle applications. So the take-home message from that was, if you're below 3.5 billion, pretty good chance you're not helping at all. In that same study, 9 out of 11 papers that were above 3.5 billion showed statistically significant benefit versus placebo or control for the same soft tissue applications. So Achilles, gluteus, medial lateral tennis, elbow tendinopathy, all these indications. My message would be get at least above 3.5 billion platelets for soft tissue indications, preferably closer to 5, because the studies that have quantified higher doses have shown even better outcomes versus studies that were lower doses. So that's my answer for soft tissue. For the joints, for intra-articular applications, at least above 5 billion is where I'd like to be. We've got 2 kind of landmark studies for knee-OA, for example. One is out of India from Dr. Bansal, which was a study that's widely quoted now, where he documented a dose of 10 billion platelets in a single injection, and his patients did well for at least a year. He wrote the paper up at a year, and they were still doing well, the vast majority of them. There's another study out of China by a doctor named Dr. Chu, who did a slightly different protocol at a lower dose. So he did a dose of 4 billion platelets weekly for 3 weeks. So the total dose was 12 billion, but it was 3 injections at that, each injection being a lower dose. So those patients in his study did well for 4 years. And, hard to believe that you're doing something for 3 weeks and people show benefit 4 years, but that's what he documented. Both of those studies were level 1 double-blinded studies. So you can support multiple injections. You can support high-dose single injection as well. But the key is you want to be a higher dose.